Well, to talk more about the testing numbers and how India has been testing under 1 million for the last 4 days. Also, the testing in Mumbai has been much lower. Remember, Mumbai has been seeing fewer cases being reported, but this testing has also come down significantly in the last couple of days. We are joined now by Dr. Abdul Samad Ansari, Director Critical Care Services, Nanavati Super Speciality Hospital in Mumbai. Thank you so much, Doctor, for joining us. If you could, we've been seeing the number of cases in Mumbai coming down quite significantly, in Maharashtra, in fact. But if we take a look at the testing has also come down a lot in Mumbai over the last couple of days. Of course, you can blame it on the festivities and Diwali.
No, I would actually put the perspective right by saying that the testing has come down and it is commensurate with the reduction in the number of cases. So actually, we had the unfortunate kind of privilege of being number one in the country for a very long time. But as the numbers have come down, we can very clearly see the decline in the number of emergencies that we are getting in our ICUs. The total number of occupancy in the COVID areas of most of the ICUs has significantly come down. And that's probably the reason why the numbers have also come down for the testing. So it's not that we are testing less. That's why people are falling sick. People are falling sick, and hence the requirement and the need for testing has also parallelly dropped down.
All right, and we're also joined by Rijo M. John, who is a health economist as well as a consultant with the WHO and somebody who's been really tracking these testing numbers and all the data that's been coming in. Thank you so much for joining us. Your views on the all-India testing that's taking place over the last 4 days. We've tested under 1 million every single day, though in the last 24 hours, it's been over 9 lakh people being tested.
Yes, Gargi, you're right. We have considerably reduced the testing at the national level. In fact, when I track the daily average testing that the country has been doing, it is dropped to below 1 million mark for the first time in about a month's time now. We had achieved a peak of about 12 lakh testing per day sometime in late October, and now it is declined by about 20% right now. So in fact, when I look at the last 1 week reported cases and reported tests, you can see that there is a 14% decline in the overall reported cases in the last 1 week. And commensurate with that, we also see a 14% decline in tests. So obviously, it looks as if it's a case of, you test less and you report less. And this is a national level picture. And, even if you look at the state level, in fact, there's not a single state which has really increased the testing. In fact, most of the states that I'm observing have decreased the testing in the recent times very significantly. And that has actually contributed to increasing tests in many of these states. In fact, some of these states are, in fact, witnessing an increasing test positivity rate, and yet they are decreasing this number of daily testing, which is really not the way to go.
All right. We also are, we've also been pointing out about how the difference between rapid antigen tests as well as RT-PCR tests, Doctor. If this is something you can just tell our viewers about why this is so significant to know the percentage of RT-PCR tests, which is the gold standard, which gives you the best results, and the rapid antigen test, which is cheaper to do, it's quicker to do. However, it's often not accurate.
Yes, that's right. But I'm like somewhat double-minded about it. In fact, for a country like India, which is quite resource poor, our priority is to conduct as many tests as possible. But of course, in the process, we are compromising on the quality of test a little bit. Definitely, the antigen tests are, have much higher rates of false negatives. So that is why ICMR recommends that, you have to do a retesting of all those false negatives from rapid antigen tests, especially for those who are symptomatic. But then, the problem is that, many states in India are highly dependent on rapid antigen tests. States like Kerala, for example, more than 80% of the daily testing is through rapid antigen tests. And Delhi and a couple of other states also, which are doing close to 70% or more of the total daily testing is through rapid antigen tests. So even if you were to, do a retesting of all the negatives thrown out from these rapid antigen tests, it could be quite difficult because, their existing RT-PCR capacity might not be even enough to do a good amount of retesting that is required. And in fact, none of the states actually publish data on whether, if and whether they are actually retesting or how many they are retesting through RT-PCR methods for those negatives from antigen testing. But on the other hand, of course, as you rightly said, the rapid antigen tests are much cheaper, almost 1/5 of the cost of a RT-PCR test. So, and it is also good at, detecting high viral load cases. So in that sense, it's really good to, enhance the capacity of rapid antigen tests. There's no problem there, but also simultaneously, we need to also increase our capacity for RT-PCR, to be able to retest all the negatives thrown out from rapid antigen, as well as to ensure more accuracy. Yes.
Absolutely. Dr. Ansari, if we talk about the Mumbai situation and if we look at what's happening in the national capital right now, where we're seeing the cases exploding. In fact, there's been talk of increasing the testing in Delhi, to catch where the hotspots and catch where the virus is spread. But if you compare that to Mumbai, which had seen an explosion, but at the same time, now, you're claiming that there are other factors which are proving that the cases are coming down because of, hospitals and ICU wards, etc. But still, there's a requirement for Mumbai to be on its guard if Delhi is experiencing the third wave. And we don't want that in any of the other states, and especially in Mumbai and Maharashtra.
No, I cannot.
So 1 second, let Dr. Ansari answer. Yes.
Yeah, no, I cannot agree more that it calls for increased vigil. And the numbers actually, that's good for epidemiologists to explain why this is happening. But we must understand that Mumbai is multiple cities in a city. So unless you track the virus, chase those areas which are hotbeds, hotspots, and try to contain them. So your numbers should be more importantly done to those symptomatic or the areas where there are maximum number of cases and an increased transmission happening. But if you are able to, kind of close them, have better understanding of the number of cases which are coming positive in that area and do focus testing, chasing that is the only way in which big metros like Mumbai, Delhi, Kolkata would be able to, tackle this menace. There would be spurts. There would be surges in the cases, and that has to be seen very closely. And we need to, kind of be flexible in our approach than a very rigid platform that we keep on testing and finding out the people. I think we need to be more.
All right. Well, thank you so much, Dr. Ansari, for joining us on the show, as well as Rijo M. John for sharing, your analysis of the numbers that we're seeing in the country. As we were saying, over the last 4 days, the testing has come down to below 1 million for every day that we're seeing. And earlier there was a lot more testing. The numbers also, remember, have been decreasing.